Good afternoon and welcome to the COVID-19 public briefing for Thursday, April 23rd. I'm Brian Beam, Calcasieu Parish Police Jury Administrator. Excuse me, we're getting a little bit of an echo. We'll try to work on that. We want to start off, we have our usual speakers, but we also have a couple of new ones today. And we'll go ahead and get started with Dick Grimion, Director of Homeland Security and Emergency Preparedness.
Thank you, Brian. We're completing our third week of testing at the Burton Complex. Things were a little bit slower this week. I think we had 42 total this week. But we urge people to continue to seek out testing, whether it's at the Burton site or any of your private facilities that you might find. It's very important for us to establish that data so that we can see where we are on the so-called curve, and any extra testing that we get done helps us out on that. We will continue next week, Tuesday, Wednesday, Thursday, same schedule from 9 a.m. to 12 p.m. At the end of next week, we will reconvene our medical experts and decide which is the best way to proceed from there. We could be doing the same thing, or we may be looking at a different arrangement, but we'll let you know by the end of next week what we might be doing. Just a preparedness note, as we always say, wash your hands, cough into your elbow, and most of all, keep that social distancing. Now, the governor has asked everyone to wear a mask outdoors or when you go out. And it could be, I've seen some pretty nice cloth masks or just a regular paper mask. But just beware, that is not to protect you from getting the virus. That is to protect other people from getting infection from you. If everyone wears one, then we'll be in good shape because we'll all be protecting the other folks that we get around. So just a note of caution. That is not for you to avoid getting the virus, so you still need to maintain that 6 feet social distancing. Thank you.
Thank you, Dick. We will next hear from Dr. Lacey Cavanaugh, Region 5, Office of Public Health Director, and she's remoted in at this time. So, Dr. Cavanaugh, go right ahead.
Thank you. Good afternoon, everyone. As usual, I'd like
to start with a brief update on where we stand in terms of numbers. So the state so far, as of noon today, had over 25,000 cases. There are over 140,000 tests that have been done. If you have noticed, the number of tests on the private lab side have not been updated in a couple of days, at least not the number of negatives. The positives continue to be reported, but the negatives, we are working on migrating data from one system to another so that we have more capability and sort of planning for the future. So those numbers hopefully will eventually start to be updated again. But right now they are, they should eventually come live. We have 1,540 deaths so far within Louisiana. For Calcasieu, we're at 352 cases with 24 deaths, Beauregard 35 cases with 2 deaths, Allen Parish 81 cases and 9 deaths, and Jeff Davis Parish 57 cases with 5 deaths. And we are having some difficulty with Cameron in regards to tracking those cases because some of those cases are being reported in Calcasieu. We are aware of that issue, but we know the numbers on the parish map website are not totally accurate. So I'm going to refrain from reporting that number today because it is something that is actively being worked on. A few new features of the website this week. One is that the parishes or regions that have at least 25 or more deaths are starting to report data on the demographic breakdown of those cases. So you will see that as a new feature on the map as you start to scroll over on the ldh.la.gov website. You also can start to see those racial disparities broken down by region, not just state data. And they are existing in almost all the regions across the state. Another difference you'll notice over the past few days is that now probable COVID deaths are reported in addition to confirmed deaths. And so what that means when it's a probable death is that either the test is pending or for some reason a test was unable to be performed, but the physician or the coroner felt strongly that it is COVID. So those numbers are apt to change over time as test results come back. So those people who are pending test results, we wanted to be able to capture that data more accurately, knowing that sometimes it's several days before those test results come back. And so that's why you'll see that new category under deaths that talk about probable deaths. Another change is that now if you scroll through, you can actually see the data down to the census tract level. So for larger cities, this is going to be more useful because you can really see where within those cities cases are clustering. For rural areas, it's obviously not quite as helpful, at least not yet, because we still have a relatively small number of cases. And so they kind of group them into, say, 6 to 20 cases as one color. It's sort of a heat map. But it does allow us to identify sort of hot spots within communities that may need more targeted messaging or more access to testing. So that's also available, but it is only reported for census tracts that have over 1,000 people so that we can make sure that we're protecting patient privacy. A lot of things that we've been talking about still remain right now. And the shift has started to focus on how to protect ourselves as we move into this new phase of the future, with some limited services eventually being able to be provided within our communities. So that makes things like hand washing even more important than they've ever been. Got to make sure you wash your hands for at least 20 seconds. Sing happy birthday song twice is what we say to make sure that that you do a good job. The other thing about masks, I'd like to second Dick's point that there is definitely a recommendation to wear a mask if you have to go out in public. It doesn't have to be a fancy surgical mask. We'd actually prefer for it not to be a medical grade mask because we need to continue to save those for our healthcare providers and first responders who are working on the front line. But homemade mask with either cloth or with a t-shirt. I've seen a lot of how to make a mask yourself videos online. And so those would all be appropriate to wear out in public. And it does mean that you are protecting other people. Doesn't necessarily protect you from getting COVID, but it protects you from being an asymptomatic carrier that then spreads it to someone else. It's still important, even if we are wearing cloth mask, it's still important to stay 6 feet away from other people in anything and everything that we do. We actually, both LDH and the CDC are not recommending wearing gloves for routine public contact. And the reason why is because it may do more harm than good. People seem to get a false sense of security when they wear gloves. And so they may touch a surface and then think, well, I'm protected, I don't have to wash my hands, and then touch another surface. And so they're just using the glove as a mode of transmission to spread it from one surface to another. So the best thing to do is to not wear gloves and to actually just wash your hands very, very frequently, especially if you touch a surface that's a common surface. We received a question this week from someone in the public talking about asymptomatic transmission. And so those people who have no symptoms who are carrying the virus, there are questions about how long they carry the virus and how contagious they are and if they could potentially be spreading that virus to other people. So we do know that those people do recover. We don't know exactly how long they spread the virus. Could be a week, could be 2 weeks, could be a month. We know it shouldn't be for a prolonged period of time. These people do eventually recover. They do eventually mount an antibody response. And we hope and we think that that antibody response will be protective. Of course, there's still a lot of scientific data that we don't have about COVID. The amount of time that person is infectious definitely could vary from person to person, and that is still being studied. But just know that those asymptomatic people do not carry the virus forever and spread it from now until beyond. They do eventually recover and stop spreading that virus. So we received a concern about that this week, and I wanted to mention that. I got an analogy for you today to try to speak a little Louisiana language. I know many of us in our communities love football, so I'm going to use that as an analogy of where we are along this COVID spectrum. So we're still pretty early in our response to COVID. Think of this sort of like we're at the end of the first quarter and we're doing really good. We're up by a couple of touchdowns, but we know that we still have a couple of quarters to go, and we know how fast things can change on the ground. So we can't let our defense against this virus start to get lax at this point in time, because we know how fast the score can change. So it's still early. I don't mean to diminish the severity of this situation, because obviously it's much more severe than a football game, and it's lives that we're talking about, not a score. But just thought that that would be a way to think about it, that this is not over. It's still early. It can change fast, but to also be thankful for the success that we've had so far, because the social distancing measures that we have done to this point in time have really gotten us out ahead of this, have given our medical community time to respond, to learn more about the virus, to work on development of vaccine and of treatment. And definitely we're at a better place now than what we thought we would be at this point in time. So that's a good thing, and something that we thank all of you for. Last thing I wanted to really talk about is, of course, you may have all heard that starting next week, some time-sensitive medical procedures will start to be performed within our hospitals and within our community. One of the big concerns with this virus is that people are scared to seek healthcare. And if they are scared to seek healthcare, they may not go to the emergency room if they're having a heart attack or a stroke or some other potentially very serious medical condition. So that's obviously concerning, because if we save lives from COVID, but we lose lives because people are scared to seek care for routine things, then we've in some ways defeated our purpose. And so I wanted to introduce Dr. Timothy Heyman. He is the Chief Medical Officer at St. Pat's. And I'd like for him to spend a few minutes just talking about some of the things that our hospital systems here locally are doing to make sure that the general public is safe as we move forward in the next phase of response to this disease. So I'd like to turn it over to Dr. Heyman.
Sure, thanks, Lacey. Just kind of emphasize on what she was talking about. I think the important thing that we need to see, and I've heard this from talking to some of the primary care doctors and some of the urgent cares around town, is that right now people are afraid to come to the hospital. And so we need to do what we can to make sure that people understand that the hospital is a safe place to come, and that they need to seek care if they really feel that it is critical. One of the main things we're doing is, obviously, all the facilities in the area are cohorting our COVID patients to one area. So, here at St. Patrick's, we have a ICU for COVID patients, and we also have a medical surgical unit for COVID patients. The rest of the hospital does not have any COVID patients in it. And so, people should understand that if they have COVID, we're absolutely here to take care of you. But if you don't, then there's also a place that you can go that is COVID free, and that we can make sure that we can treat your condition. In terms of these procedures that are starting up next week, we are going to be pre-screening everybody with their routine pre-op lab work for any COVID symptoms. We are still maintaining social distancing with that. We have our waiting room for our preoperative testing areas set up to keep people 6 feet apart. And then there's also a recommendation in that order to keep yourself quarantined from the time you come for your preoperative visit until the date of your surgery, to try and make sure that you're not impacted there. All the hospitals in the area are still doing screening at the door to the facility for symptoms of COVID, as well as temperature screening. And we are also here in the very near future going to be doing testing on our staff once we have more tests available. And so I think that will help increase the public's confidence. I think, again, and I did an interview with KPLC just about an hour ago about this, I think that the critical thing is people should understand that all the hospitals are still here. We're able to take care of you in a safe way, just like we were before all this started. And so it's important to not wait until the last minute to come in, because we are seeing that in other areas. I know in New York and some other places, they've mentioned that, people are dying in their homes because they're waiting too long to come to the ER. And so that's the last thing we want.
At this time, let's let any Kavanaugh or Dr. Heyman.
First of all, I was wondering how backed up the area is as far as getting these surgeries done, and is there any particular way of perhaps, prioritizing the people who've been waiting to get surgery?
There certainly is a backlog, surgeon. I don't know the degree of significance, but we are working with our surgeons to prioritize. The language that we got from LDH was that they wanted us to prioritize, especially cases that had already been postponed for 30 days, to really try and look at those first, to make sure that if they were time sensitive and needed to be done, that we got those people done first, and then try and look at new add-ons as we go along. But I think the language in there was pretty clear that if it could not safely be postponed and there would be adverse impact to the patient, that we could go ahead and get the procedure taken care of, and that's what we anticipate doing.
Thank you.
Thank you. I also
If there's
wondered
any
if there's any
updates as far as the nursing homes and whether we have any hot spots, and whether the public can perhaps, have more information about how that's going.
So I can talk a little bit to that. So we do have nursing homes that are impacted by COVID, not just here within our region, but really and truly across the entire state. We have a very large number of nursing homes that are impacted. We are not releasing information about what specific facilities and how many cases at those facilities, but CMS, which is the Center for Medicare Services, did put out some new rules this past week that talk about what sort of notification needs to happen for nursing homes who have positive cases. And so I know that is all still being worked out. The details of what's going to be released when and how and where is still being worked out. But I do expect that at some point you will receive more specific information about that. I can say that from an infection control perspective, we here at our office have been in very frequent contact with those nursing homes that have cases to provide advice and technical assistance. I know the PPE supply, so the protective equipment supply at nursing homes, has gotten better. We've actually started to receive supplies here within our office and are working on getting those distributed to nursing homes and clinics. So the situation, although nursing homes are definitely an area of grave concern because they are a very high-risk population in a closed space, and this can be a very deadly disease for a nursing home. But we are working very hard to make sure that it is as safe as possible in those places.
I'm sorry, somebody just texted me a question, wants to know if I could ask one of the doctors if it is safe to get a haircut if the barber is wearing, let's see, I'm sorry, something just messed up here. I guess if the doctor is wearing protective equipment or something, not the doctor, if the barber is wearing protective equipment or whatever.
I know everybody's been asking about that because now that it's been a while since we've all gotten our haircut, we certainly would all love to get a haircut right now, but I would still say that would go against the spirit of the governor's stay-at-home order. And for what I've seen on the national level, I am not expecting that barbershops are going to be in the first level of critical folks that end up going back. Now, I could be surprised because, of course, we don't have the specifics yet of what May is going to look like. I know that there are a lot of discussions going on about what critical things really need to start back and which can wait a little bit longer. But I know it would definitely be nice. I personally would love to go and get a haircut, but I still would say that it would not follow the spirit of the governor's order, and it would not be advised at this time.
Okay, we'll move on to the remainder of the agenda. And we want to thank Dr. Kavanaugh as always, and also today, Dr. Heyman, for joining us. Very helpful information as things start to change a bit in the near future. Let's hear from some of our elected officials now. Calcasieu Parish Police Jury President Tony Gilry will be first.
Thank you, Brian. I just want to thank everyone for their cooperation and patience during these times. We will get back to the normal, but it's going to take time and patience. Also, as of now, the police jury will hold a regular public meeting on May 7th with public access and participation at the location. Stay tuned to the police jury's Facebook page and website for details on the meeting and how to participate. Again, thank you, and as always, stay home, stay safe, and save lives. Thank you.
Thank you, Tony. Remotely today, we have Mayor of Lake Charles, Nick Hunter, who's going to be next.
I tell you, on a very emotional level, I want to let you all know that I cope with you on the haircut conversation. It has been a long time since I have personally had a haircut, and I am feeling the effects of that. So I can cope with you all on that. I just want to mention a couple things to the public out there. I know that there's a lot of frustration, and we've been cooped up for a few weeks now. Just a reminder as to where we are right now. The governor has an executive order in place that is set to expire at the end of this month. So nothing monumental as far as a change in that order is going to happen before the end of this month. And I think that's a very safe assumption. On a local level, I want to remind everyone that we supported the governor when he issued that executive order. And just as we supported him, we also made a decision locally not to make further restrictions beyond what the governor asked in his executive order. And while I can't predict the future, I don't see that happening locally. When we do act, I think it's very important that we act as one group for Calcasieu Parish. The Executive Policy Group exists. It has been a wonderful tool throughout this crisis. The Executive Policy Group consists of all the mayors of every city, the police jury, OEP, sheriff's office. We've spoken with one voice. There's been a lot of unity throughout this event, and I think that is for the betterment and the good of Calcasieu Parish. Just as a reminder, even if I, as mayor, wanted to do something different for the city of Lake Charles, I can only issue an executive order for the city limits of Lake Charles. You could literally have, if there was a drastic difference in opinion or direction, you could have businesses or neighbors across the street from each other, one inside city limits, one outside city limits, that would be trying to cope with two different versions or directions. So that's why it's so important, I believe, in Calcasieu Parish. We're supporting the governor's executive order, but also we are moving forward in one voice and with cohesion. I was very encouraged to hear yesterday some of the governor's comments at his press conference. He used the word region a couple times, and I'm not trying to put words in his mouth, but to me that says that there's a possibility that when we do look to roll out some new semblance of normalcy, some return to a semblance of normalcy, that if the governor has to, he might look at regions throughout the state. And if one region is perhaps doing or faring a little bit better than another one, that is something he would take into consideration. And I was very encouraged to hear that. And I'll take any questions if there are any. Thank you.
Thank you, Mayor. Very helpful. And to add on to what Nick said, we expect the governor probably next Monday to have information about, because he has stated it, about May going forward that's going to be a little different. And so we actually are going to have a meeting of that executive policy group, police jury president, the mayors, and the sheriff, after that to discuss, but prior to next Thursday's briefing. So that is an important point, that your local leaders are talking together along the way. We still do it, and will continue to do so. At this time, again, remotely, on behalf of Sheriff Mancuso, we have Calcasieu Parish Sheriff's Office Chief Deputy Stitch Gilry with us today. And Stitch, why don't you provide us with your comments?
Okay, Brian. So far, everything is going as normal in the law enforcement world. We don't have any major issues. I've talked to every police chief in the parish. Everything seemed to be going very well. As Dr. Kavanaugh alluded to, we kind of relate this to a football game. And, we fought too hard and we've come too far to lose the battle. Let's, as much as we like beating Alabama, we got an even bigger opponent in this virus. And it's important that we do what we can to help out our nurses and our doctors and our healthcare people, our grocery store workers and our first responders by doing the right thing. Let's just keep fighting the fight. We're winning this game. We just got to run the clock out. We're playing good football game. So to the public, I just say, keep giving us what you've been giving us, and together we're going to beat this virus.
Okay, thank you, Stitch. I can't resist. There's been 2 references to football so far. I want to remind everybody the NFL draft is tonight, and I'm a big Saints fan. If you're watching, they're going to pick at number 24 in the first round. So I'm not going to leave that one alone. Thank you for being patient, Denise. From the community assistance side of things, we want to ask Denise Durrell, Executive Director of United Way, to give a few comments.
Thank you, Brian. We just want to remind the community that we actually, United Way, has recently partnered with the Second Harvest Food Bank, and we're going to be hosting 2 food distribution events next week. On Monday, we're going to be actually from 11 a.m. to 1 p.m. at Vinton High School on Grace Avenue. And then on Wednesday, we're going to be at the Preon Lake Mall in front of Home Goods, again from 11 to 1. And both of those days, we're going to be passing out to anyone who comes out boxes of food, perishable and non-perishable, and each box equates to about 3 meals. And our goal is to give out 2,600 of those boxes in those 2 locations. So we're looking at almost 8,000 meals that we're going to be able to provide next week. So if you're food insecure or you know someone that is, please tell them if they're in the Vinton area to please join us on Monday, and if they're in the Lake Charles area to please join us on Wednesday. It is first come, first serve, and when we run out, we will, but we're going to be hosting these pop-up distribution events throughout the region in the coming days, but we're starting next week on Monday and on Wednesday, so thank you.
Thank you, Janice. I'm going to shift gears now and talk about the economic side. You have heard the speakers today continued focus on good healthcare practices, and that's so important we do that. But since we're evolving in this whole time period, the economy and opening it up, for the phrase that's commonly used, is easier said than done. How do you do it? There's been some developments along that lately that are worth reporting, and some of them at the state level, but also very active locally. And so we invited George Swift, president of the Southwest Louisiana Economic Alliance, to join us today. He is taking part in the meeting remotely. And George, we appreciate you being here, and we'll let you cover some of the highlights of that side of the COVID period.
Well, thank you, Brian, and it's good to be with you. Here at the Southwest Louisiana Economic Development Alliance, we are technically closed. The Seed Center is closed, but the Alliance is open. We've been fielding a lot of phone calls, and we can tell that there's beginning to be a lot of frustration for the business community, and when are they going to be able to reopen? And we're waiting the word from the governor on that. But just an overview, just to keep things in perspective. You know, our region is very fortunate that we have such a strong industrial base. We've got about 25 petrochemical facilities. They're in operation. Some are beginning to decline in their production because of the glut of oil and gas on the market. but the workers are working safely and they're in operation. There are also a number of construction projects underway. And of course, Cheniere Energy down in Cameron Parish, they are once again exporting LNG to China. Hackberry LNG, Cameron LNG at Hackberry, I should say, is commissioning their third train today. So they are moving along. Venture Global is under construction in Cameron. So let's don't forget the strong base that we have. Of course, we have a Chenault Air Park in Northrop Grumman. We have the Port of Lake Charles and the Ship Channel. So we've got all of these assets to build on in our recovery. Now, there are a lot of things that, of course, we're having difficulty with, and with the business community, most of them closed. We have subscribed to some data from Buxton Analytics, and they can help us track different retail categories. And we saw the fall off in some categories when the stay-at-home order was in effect. However, some retail categories, such as grocery stores and general retail, such as building supplies and Walmart and things like that, are actually having increases in sales. And so we're able to track this, and we're going to be able to tell our elected officials when we see the business coming back and help them plan for that. There's no doubt about it that the biggest impact has been in the casino and hospitality industry, with the casinos closed, thousands of people out of work. The hotels that support the casinos and the business and industry that come here are at a very low occupancy. So when will they be able to open? That's the big question. So we're keeping an eye on that. And we also know that restaurants have been greatly impacted. A number of restaurants are doing drive-through if they have that ability, or pickup and delivery, but they are greatly impacted. And that's the question that people are asking: when can we go back to our favorite restaurants? Well, it's going to take some changes, and we're waiting on that. And one of the things that we have done is worked with other chambers around the state to come up with a safe at work plan. And this is not something that can start today. It's to begin thinking about what do we need to do to be ready when the time comes. It may be 2 weeks, it may be a month, it may be longer than that, but we want the businesses to get prepared. And we also recognize that the number one factor is public safety and health. And so we're not advocating anything that would put anybody in jeopardy. But when the time comes, we know that businesses are going to have PPE. They're going to have masks. They maybe have gloves and other protective gear. Where are small businesses going to get that? And so there's a big demand for masks and things like that. So we're trying to work with some potential suppliers, and I think the OEP is also, and that's going to be key to allowing businesses to reopen. And so we're going to be working with a lot of different organizations to come up with that. Today, we had the Legislative Economic Recovery Task Force, our first meeting that I'm serving on, along with the governor's Resilient Louisiana Task Force yesterday. And we're going to be working on some short-term recommendations for the governor and the legislature, the first of which will be due on May the 7th. And then we'll be looking at some long-term policies and issues so we can help the state recover. One of the things that we're most concerned about is funding for small businesses. And you know, the CARES Act had about $350 billion for small business loans. That's all gone. Today, right now, the U.S. House of Representatives is voting on another round of funding. We understand that according to the banks and saving and credit unions, that probably this second round is already spoken for. But we're urging all businesses, if you're trying to apply, to contact your bank or credit union today and try to get in the queue. And then there's also going to be reauthorization of what we call the EIDL program. the economic injury disaster loan. That is a low interest loan that you can get through the SBA. And there's also a provision in there where you can get a $10,000 grant. And you do that by going online to the SBA.gov website. Now, there's no doubt it's going to be congested. It may even crash a couple of times, but be persistent and get on that today and try to get that money. This has been very instrumental. We've talked to hundreds of businesses that have been frustrated, but we're hearing from dozens that have gotten the money, and the local community banks have done a great job in helping navigate these loans for the businesses that hopefully will keep them afloat. So we've got a big need for funding for the businesses, the PPE for the workers, and all of that, and testing. So we've got a challenge or two ahead of us, but I'm confident that the folks in Southwest Louisiana and the business community will figure out how to make this work. And we're supportive of our elected officials who've done a great job in having a unified voice and keeping our residents informed. That's very important. And the elected officials have done a great job, and we thank you very much for that. Thank you.
We appreciate your input, George. That's very helpful and timely. And I'm going to ask all of our speakers remotely, please stay on the line, because that's the end of the list of speakers, but we always reserve a little time at the end for any general questions, and we'll see if there are any now.
Any thought whether the state should enter phase 1 May 1st, and if we do, what that would look like in Calcasieu Parish?
Well, I'll let anybody who wants to speak on that add. My answer would be, let's wait and see what the governor says next Monday, because he has said he's going to address that exactly, and it's going to apply to the whole state, including Calcasieu, so I don't want to really speculate, and let's just wait till he answers that. Is that okay with everybody?
I'd like to just add that the numbers
are reassuring that so far we seem to be on a good trajectory, but the next several days are going to be critical there. So it kind of depends on what happens the next few days, because as you know, you have to have that downward trajectory for 14 days. So we still have a couple of days to go there to see what's going to happen with those numbers.
Okay, also wanted to know if anything is being done to increase the availability of testing for those with and without symptoms, and whether there's any antibody testing going on.
Dr. Kavanaugh, why don't you address that one?
That one. Antibody testing, I think there's still only one that has the FDA emergency use authorization. I do know that there is some very, very limited capacity right now locally to do that antibody testing, but it's being reserved for healthcare workers right now because the amount of testing that we have available is still very low. I do expect that antibody testing is going to become something that we hear a lot more about going forward. Some of the labs at the national level are looking to have antibody testing that won't just say positive or negative, that will actually give you a titer, which we hope that one day we'll be able to interpret to tell whether people are truly immune to the virus. So I think antibody testing is definitely something that you're going to hear more of coming down the pipe. In terms of just general testing within the community, as we talked about, as Dick talked about earlier, the numbers at Burton have been relatively low. And I think that that's for a couple of reasons. And one of those reasons is that we're doing a good job socially distancing, so not that many people are getting symptoms. But the second reason is that testing is becoming more broadly available in the private sector within this community. Of course, all of your local emergency rooms pretty much have the capacity to test. We have several urgent cares that have the capacity to test. We have local laboratories that are doing testing. We have some private clinics, or our Southwest Center for Health Services is actually doing testing at their location in Lake Charles. So as more and more testing becomes available within the medical community, then of course you're not going to have as much of a need for a site for everybody to go and access, because they can just call their normal doctor's office and get testing. Right now, there is no recommendation, at least not yet, to test asymptomatic people. However, as testing capacity within the community increases, that may become a recommendation of the future. We're just not quite there yet because we don't have enough ability to test all of those folks just yet. But I definitely think that as we move forward, doing things like contact tracing, so identifying all of the cases and then identifying everybody that they came into contact with in that previous 48-hour period when they could have not had symptoms, and testing those people is definitely going to be part of the way forward to rapidly identify cases and make sure that those people isolate and that we make sure that their close contacts don't have it and spread it unknowingly. So I do think that those things are coming. I just think that we're still working on ramping up testing capacity. And I think that that's a crucial piece to move forward.
Okay, any other questions? Well, this has been very helpful. We hope it has been for the public. Just a reminder, we do this weekly, so our next public briefing on COVID-19 will be Thursday, April 30th. 2 p.m. We encourage everyone to watch the governor's press briefing on Monday, as we expect new information, and everything we do at the briefing next week will be in response to that, and we'll have as much information as we can. We appreciate everybody joining us today. Thank you.